Good evening. Let's start the clinical neurology again. I had asked one question in the post that what is the difference between anterior horn cell disease and the muscle disease. Clinically, we have to differentiate it on the basis of history and examination. Firstly, what part of the body it is affected means if the lower limbs are affected, what is the distribution, whether it is proximal or proximal and distal. Muscle disease are mainly it is proximal except some distal myopathies, but anterior horn cell disease the distribution is basically distal, mainly distal, except SMA in which it is proximal. So first of all you will see whether the distribution is proximal or distal. Second point is symmetrical or asymmetrical. Muscle diseases are mainly symmetrical, whereas anterior horn cell disease they are asymmetrical. Then on history you can see history and examination you have to note whether the atrophy is there or not. In anterior horn cell disease, atrophy is more predominant symptom than weakness, whereas in the muscle disease atrophy is not so much seen, and if it is seen it is in the very late stages. Then the on examination tone can be increase or decrease in anterior horn cell disease. We know that in anterior horn cell disease there are two group of disease, the element type of disease and UMN type of disease. UMN and element mix also, so the tone can be increased or decreased, but in myopathy the tone is decreased. Then early reflex change will be seen in anterior horn cell disease, whereas reflexes they are lately affected in muscle, and it is directly proportional to the weakness. Then on history you can get the history of involuntary movements like fasciculations, and clinically also you can see fasciculation is seen. The diagnosis points towards anterior horn cell disease. Fasciculations are not seen in muscle disease. So these are the major points of differentiating anterior horn cell disease from muscle disease. Thank you.